Good afternoon, and thank you very much for the introduction. Today I would like to start my talk with a little bit of the motivation behind of this work. And I would like to mention that initially this work was motivated by a real problem in medical scenarios. In these scenarios, a member of the medical team is in charge of aligning a relatively complex medical device from which they basically took, specifically in orthopedics in this case, they took an X-ray, and then they will use that X-ray as a reference after the surgery. So what they do is they took that X-ray, then they perform the surgery, and the medical team basically removes that device from the OR so they can perform the surgery. And after that, what they do is they bring back the device, and then they ask the team of the member of the team to relocate or reposition this device on the previous pose. And this is a complicated task. So basically what happens sometimes is they got a new X-ray and they got a different X-ray to the one that they need. It's not that bad in real life, but it's helped me to prove my point. So what happened is they relocate again the device, they took a new X-ray, and this happened until they finally got the X-ray that they want. And of course, this it's not good, neither for the patient or for the medical team. So achieving precise alignment of devices, of these kind of devices, might help to reduce the radiation exposure for the patient and for the medical team. So the benefits of using augmented and virtual reality for object placement or alignment tasks has been explored widely before for many studies. And we can classify these studies based in two main approaches. The first one is those approaches that provide guidance using virtual elements. These virtual elements can be animated arrows, text, or animations, as the work presented by Henderson and Feiner in 2011 or Sauner in 2003. The situation with this kind of approach is that in order to be able to provide these animations or this information, the object that need to be placed, it's a requirement to track the object. In the second approach, in which the virtual content is presented as a static objects, there is no need to track or to have precise tracking of the object in this case. And this is the reason why we focus on analysis on using these static visualizations. We can see some examples of previous work in this slide. And something that is interesting for this is, in most of these cases, they basically use the same three types of visualization to render virtual content. One of these is rendering the virtual objects as a solid object, or they can use a semi-transparent representation that provides user at least a better visualization of the object that it's behind, or as a wireframe. If it's true that this wireframe representation allows user to see through the objects and reducing considerably the occlusion when they are achieving the alignment, it's also true that the geometrical information that it's shown corresponds to the distribution of the model vertices and not to the shape of the object. So what not to try with another kind of visualizations like sketch-like. And context and visualization techniques have been used before to improve depth perception in AR. Example of these works are Kalkofen and collaborators from 2007, as well as B. Clymer and collaborators. And to our knowledge, there is no previous work that have used these kind of visualizations in alignment tasks. So then, does the selection of the virtual object representation influences the user performance during the alignment task? That's one question that we we're trying to solve? And if it does, is it possible to provide users with sufficient information to achieve a proper alignment and at the same time without generating a clutter environment? So in order to solve these questions, we perform a comparative evaluation of 4 visualization techniques that are used to render virtual objects. And 2 of these 4 visualizations haven't been used, at least to our knowledge, haven't been used to provide assistance during alignment tasks. These 4 visualization techniques will be listed in the next slide, and you will also see 4 objects that we use later for validation. The first one is the semi-transparent technique. It's basically the same object rendered on a single color with an alpha value of 0.5 in this case. The second one is a wireframe visualization, and with these 2 visualizations we use those that are frequently found in the literature. And we propose to use a Fresnel derivative-based shader. So in this one we have 2 main components. The Fresnel component allows users to see or uses the angle of incidence. So when the object is looking straight to the object and the normals of the surface are parallel to the user's view, then the object is rendered as transparent. And then in the edges, you can see how this transparency is being reduced until it makes a solid object in the edges. Well, the derivative component helps us to see regions with high curvature. For example, if you look at the skull, you can see that even though in the middle there are transparent sections, there is also some parts where you can see some lines. I'm not sure if the resolution is good, but this also provides some visual cues to the users to achieve the alignment. And the last one is the silhouette, which is pretty much like a sketch of the object. And in the next slide, you can see the result of overlaying a texture object with each one of these 4 visualizations, and you can see that the rate of occlusion decreases from the semi-transparent until the silhouette one. So we were trying to see if having a visualization technique with a low rate of occlusion will help users to achieve a proper alignment, which is desired especially in medical scenarios. To do this, we conducted a user study. We decided to do this study in VR in order to have a controlled environment and to make sure that the geometric properties of the objects to be aligned will match, and also to get good scores for the alignment. We had 32 users, 11 female, 21 male, 6 of them reporting using AR or VR system at least once a month, and 19 of them never used VR before, and none of the participants had previous experience with the system. We divided our system in 3 different stages. In the first one was just a simple tutorial where the users learn how to manipulate these objects. They had 2 interaction modes, which was a normal mode in which they basically click one button and automatically the object was attached to the controller. And they had a precise mode that allowed them to modify translations and rotations into a 10-to-1 basis. So if they translate the object 10 centimeters, the object will move only 1. And then for the testing scenario, we tried 2 different ones, one without time constraints and another with a time constraint. The users had to perform each task. They aligned 16 pairs of objects that correspond from all the possible combinations between the 4 objects and the 4 visualization techniques. And we collected quantitative and qualitative results. Quantitative in terms of position, orientation, and time to completion. And we also get scored for usability and mental effort. The results shown that using the silhouette visualization technique get the best results in 6 out of these 7 scores, being the semi-transparent the only one that performed the best in translation for the scenario with time constraints. A statistical analysis revealed significant difference for usability and mental effort. And we also group all the scores by model to try to see if the geometry of the object influences somehow the performance achieved by the users. And we find out that the MOG was the easiest object to align, or the one that get the best scores for translation. But it was the second worst for rotation. And something similar happened with the balloon, which got the best scores in rotation, but was the second worst in translation. So this might be an indicator that either the user focus their attention on translating the object, and once they have a good score in translation, then they don't consider that much the orientation, or the opposite. If they achieve a good orientation, then maybe they don't put that much attention in the translation scores. And interestingly, the school model was the hardest one to align. And it's probably because if you see at the model, it's kind of a combination, like 50 or 60% of the object is this round form, and then only the other part have more information. So considering this, our results suggest that using visualization techniques with low rates of occlusion might lead to better performance in position orientation and time to completion, even though there is no statistical significance in these results. However, the users prefer the techniques that present the lowest amount of occlusion for usability and mental effort. So if we can achieve good scores, even though the method that we use, then why we not use those that the users prefer? And lastly, talking about the geometries, this suggests a relation between the geometrical properties of the object to be aligned and the performance achieved by the users. And with this, I will finish my talk. And if you allow me, I will just invite you to the medical augmented reality summer school that we have on August this year. So if you are interested, just please visit the page.
So thank you, Alejandro. Do you have any question? Yeah. Because we are forecasting.
Hey, thanks for this talk. My name is Dan Keefe from University of Minnesota. I guess one of the things that's interesting to me is I'm kind of surprised by the results. I wonder if you were as well. Like for the silhouette, it seems like you're not getting any depth cues to do this docking task on the front face. I could see not wanting it to be occluded by like lots of information, but wouldn't like even a little bit of like if you had a very light wireframe, you know, that didn't occlude too much but just had a little bit, do you think that would be the preferable situation? Because to do a 3D docking task, it seems really strange to me that the best option would be one where you are not showing any depth information.
One of the advantages of this visualization is that if you change your rotation, then the features that you will see will change. So that's kind of provide a cue to the user. I agree that combining these techniques might get better results, but the idea of the study was just to compare these individual visualization techniques and to see if there is a preference on one of these.
Actually, the motion's an interesting idea, because I would also think the more you can encourage people to move around, the better they'll do. So actually, if your visualization technique encourages them to rock, maybe that actually even helps.
Yeah. Cool. Something that it's really interesting also is how the users behave with each one of these techniques. In some of them, they used to rotate a lot around the object. In the others, they just put it on one position, and then they move probably at 90 degrees, and they just push it in the other way, and then the alignment was pretty much correct.
Hey, thanks for the talk. Jason Orlowski from Osaka University. Quick question about one of the measurement metrics. I
Yes.
may have missed it, but so in the video with the camera, where they were docking the camera, it appears that they released the camera in 3D space and then re-grabbed it to rotate again.
Yeah,
Did
there
you-
is.
Did you measure the number of re-grabs by chance that it took for each object or per method?
We scored them. Yes, we have the amount of.
Okay, and sorry, maybe I missed it. What, did you have a slide on that?
It's not one of our metrics.
It was not one of your
No,
metrics.
it's
okay.
not one of.
Might
our
be
metrics
interesting to
because
explore
we are.
that.
Yeah. Okay.